culture can make a difference in lots of different organisations, both for the people who are treated there, the patients in hospital, for example, people living in residential care homes, but also it improves the environment for staff, improves staff morale, improves the aesthetic environment.
I think that A&E is a very challenging environment. It's very busy. People here are often quite stressed, not just the patients and the relatives, often the staff. You often see people looking at the artwork and it just gives them the opportunity to escape. I think the quality of the artworks we've got in the department is fantastic, and I was really surprised when we went to view the artwork. If the environment feels cared for, I think as a member of staff you feel that you're more valued and you're likely to give more back.
When I've had art brought into an area where I've worked, it does make you feel much better at work, and it does make the place feel less clinical, it feels more homely. There's high anxiety when patients in hospital, and if they can divert a little bit into some art, certainly I see and feel that they actually get a relaxation feeling from it as well.
Looking at artwork and talking about artwork stops hearing voices, everything like that, and it calms you down. And the quality of the artwork is very, very good.
The artwork has really helped take away, yes, it's a hospital, it's a clinical environment, but it also helps you on your journey to recovery. It also helps for staff to engage and interact with service users because it can be a point of conversation.
I think we should understand when people walk into a hospital, they could be facing maybe the worst day of their life. They may be frightened, they may be disoriented, they may feel scared. And what can happen in that moment when someone meets a piece of art, when someone sees something on a wall, when someone encounters an art therapist, there's something about art that can just absolutely cut through that moment and connect with somebody. It can reach somewhere way beyond pills or surgery or whatever. It completes the process.
I think it makes a difference to the patients having the paintings. I think it's a much more welcoming and calming environment.
A biopsy procedure is quite an invasive procedure. The women who are having them are obviously quite nervous. So we thought artwork is something that would distract a patient, give them something else to think about, and just brighten up the room for everybody.
Patients are obviously anxious when they come into this department, and if the area feels slightly less clinical, I think it's to their benefit.
We sort of made a group decision on each one and how we thought that it would make other students feel and how they would react when they saw it. I like this painting because it sort of reminds me of being near the sea, and I find it really calming.
I think it makes a lot of difference to the patients, especially coming into hospital feeling down. It just makes them feel, alive again.
I think that there will be more focus as people get older and are living longer on the importance of maintaining good health and well-being, and art has a vital role to play in that.
I do like going to galleries, but often I don't feel well enough. Tiredness is part of my condition. I've got lots of tumours in my liver, so I get very tired. And I think being able to come somewhere when you're not feeling well, but still see beautiful art is so important. I suppose it takes you out of yourself, and if you're not feeling very well, you need something to take you somewhere else. And to me, that's what art does.